Well, CBS News is launching a new 3-day investigation called Medical Price Roulette. It takes a closer look at the rise of healthcare costs. And we partnered with the journalism company ClearHealthCosts to explain why Americans borrowed an estimated $88 billion with a B from medical expenses.
CBS News consumer investigative correspondent Anna Werner spoke to one man who faces thousands of dollars of debt.
I'm an average working person. I'm not a millionaire. I go to work every day like everybody else.
Frank Esposito is a tool and die maker who for the last year has been fighting for his financial life. A fight he says began last March with unrelenting back pain.
It's kind of back pain that just wouldn't go away no matter what you did.
Esposito's an active person, but says back then he could barely move. An MRI soon showed a bulge in his spine, a herniated disc. And when he went to see a specialist,
he said, "You need to go to the closest hospital immediately."
Immediately?
Immediately.
He says doctors at the emergency room told him he needed surgery.
Herniation was so severe that it could have severed my nerve in half.
So you would wind up paralyzed?
Paralyzed for the rest of my life.
The next day, they performed a fusion, which Esposito says successfully relieved his pain. But the next month, the bills started coming.
Your statement says, please pay $220,850.
Correct.
And that was just one bill. In total, his bills added up to over $650,000, money his insurance company said he would have to pay. They claimed his back surgery was not an emergency and not medically necessary.
Well, it was my choice. Just be paralyzed for the rest of my life. Then to get these bills that was so overwhelming, you say this can't be real. I mean, I really don't have to pay this. How am I going to pay this? And you sit there and you start crying because you don't know what you're going to do.
He's not the only one. 4 in 10 consumers polled in 2018 said they received a surprise medical bill in the past year. Half of those were over $500. Another study found over a 5-year period, consumers' out-of-pocket medical costs went up more than 50%, even if they had health insurance from their job.
Nothing about the United States healthcare system really makes sense.
Aaron Carroll is a pediatrician and health services researcher who says there's no transparency in healthcare pricing.
This is somebody who's in pain and now has been told, okay, you might be paralyzed unless you run to the hospital. How are they supposed to become good shoppers and make complex, rational decisions? They're going to say, please tell me what to do, because that's your job.
Even if it's not an emergency, we found there can be surprising swings in what a given procedure or test can cost. Our partner ClearHealthCosts surveyed cash prices used here as a benchmark for comparison, in 2 major metro areas, Dallas and San Francisco. For a simple blood test, prices ranged from $10 to $176 in the Dallas area. In the San Francisco Bay Area, from $15 up to $126. The cost for an ultrasound of the abdomen in Dallas ranged from $115 to an estimate of $2,459. From $100 in the Bay Area to $2,800. And where the price is set can affect your cost, whether insured or not.
I think people have an assumption, for right or wrong, that insurance is going to protect them. If we pay that much, we think we're going to be covered, and we're not going to see that surprise bill. So when you do, people are shocked.
If I'm hearing you correctly, you're basically saying that people should not expect their insurance to protect them. Isn't that why we have it?
So there's protect and there's protect. Plans will have different deductibles, different amount of co-insurance, different amount of co-payments. And it also depends, of course, what they're charging, what the price is, and then how much you are responsible for that price.
Frank Esposito finally chose to hire and pay extra for a company to negotiate those bills for him. But he still owes over $220,000 and doesn't know how he'll pay.
You work all your life. You work to buy a house. You work to have a house. You have to save up for everything. We would like to be able to know that we can go to the doctor, that we can get healthy, that we can get taken care of without losing everything we have.
Well, earlier on CBSN AM, I spoke with Anna and the founder and CEO of ClearHealthCosts. Her name is Jeanne Pinder. I asked them about what the investigation uncovered and what patients can do.
You don't know in advance what's coming your way, and because you probably have insurance and you don't know what price they negotiated, and by the way, they don't talk about what prices they've negotiated because they consider that to be a private marketplace between the doctors, hospitals, and insurance companies. And the insurance industry says that they believe that if it was transparent, that the prices actually would be higher because everybody would know what the prices were. That's their position.
Okay. What you've noticed is that there is a sort of a wide difference in prices. You guys did a survey.
Yeah.
Why is there such a wide difference? Talk a little bit about those numbers. What are they?
So ClearHealthCosts, which is Jeanne's company, did the survey work for us. They've done that in a number of markets around the country. And you do see, right, Jeanne, in all of these markets, you see these wide swings in price. And tell us why that is.
Because there's no transparency in health costs. Nobody has any idea what stuff costs in healthcare.
Which sounds so simple, like it couldn't be real.
Yeah.
But the truth is that hospitals will set their prices, as the AHA told us, based on whatever they think is appropriate for their own hospital and business or healthcare network. So, you go to a market like Dallas, you go to a market like San Francisco, you see the swings, but you don't know exactly where your provider comes in. And then, depending on your insurance, depending on, maybe there's a cash price that's cheaper than your insurance. There's a lot of questions you have to ask, especially if you want to shop around to find out what prices really are.
So in your survey, as I gather, you guys looked at cash prices, right? So most people have insurance. So why are cash prices actually relevant?
So cash prices are important partly because that represents what a provider and a patient will actually agree on in price. The prices vary by a lot, and the cash prices indeed can be much, much lower than the charge price or the insurance price.
I had asked you while this was happening, could two different people, go to the same facility, get the same treatment, and pay radically different prices? And you said yes.
Yeah. I mean, are you paying cash or do you have insurance? How much does your insurance pay?
Right.
I don't know if you can think of another example where they might have a different price.
Where has your deductible been? Have you spent down your deductible? Do you have co-insurance? You pay 20% of the sticker price or 20% of the negotiated rate? It's all like smoke and mirrors.
It really is.
Yeah.
So you're in the situation that the gentleman is in. You get this bill and it's a whopper. How do you fight it?
So you can fight it, and you should try to fight it. I know Jeanne would tell you you absolutely should
Always
try to fight it. But that can be difficult. He actually hired a company to help fight it for him because he got nowhere. But strategies for consumers we posted on the website, but Jeanne could probably give us just a couple of them right here.
Well, we also suggest that you try in advance. Many things are shoppable, so that if you actually think of your encounters with healthcare, your sore throat visit, your MRI, where are you going to buy your blood pressure medication, many of those things are shoppable. So we give hints on how to shop in advance. Many things aren't shoppable. Nobody really wants the cheapest appendectomy or the cheapest cancer care.
Good point. Right. But I mean, it never occurred to me that you could ask. I mean, how much do you pay for, say, how much would I pay for a mammogram here versus the hospital down the road? You can ask those questions.
And one of the things that we've learned out of doing this work with ClearHealthCosts and Jeanne is that a lot of times the hospitals are more expensive than a standalone facility. So if you are getting an MRI, for example, you can ask the hospital what their price is, the hospital that your doctor may refer you to. But you can also call standalone facilities, get the names of some of those, and find out, hey, how much is your price? Because you see wide variation in those prices. And it's just sometimes because it is a hospital versus a radiology center. I had that happen a couple months ago, just trying to check for some tests.
We had a woman in New Orleans who saved nearly $4,000 using that strategy on an MRI.
You know, Jeanne, what's occurring to me is there needs to be almost sort of a cultural shift about how we treat our own health care. There is this idea that you go to the doctor and they tell you what to do, and you sort of passively go along the system, especially if you have something that requires sort of multiple visits and perhaps specialty doctors. You just sort of suddenly you're in the system and you keep going, and you typically don't say, I'm going to be an active participant in how I'm treated and how much I pay for this, and what's important to me I'm willing to pay money for, or whatever.
That's so true.
Yeah.
It's really important for all of us. And it's not just about the money, it's also about the outcome that you want.
Right.
And taking charge of that it's not natural to us yet, but it should be.
And one of the things that is also not necessarily natural in journalism is usually we're giving you the information, but here we want to say we don't just want to be giving information, we also want you to share with us. So we want you to, the viewers out there, to go to cbsnews.com/healthcosts. Right here you're going to see cbsnews.com/healthcosts. Go to this and you will see below medical price roulette, there will be a button that says share and search prices. So you'll be sharing your prices, and also you can search the prices that Jeanne's company surveyed for us in Dallas and San Francisco and see the variances. You can go to the webpage and see the variances. Basically, when you click that button, you'll have to go do a couple clicks, you'll land on their page, and then you can see. We want you to share what you paid. Tell us what you paid for your medical procedures, so that we can help report what people around the country are actually paying. Because again, the insurance prices are negotiated in secret. So we don't know what you paid, but we want to know.
Absolutely brilliant, because the insurance companies aren't going to do it, the hospitals aren't going to do it, so I'm glad we're doing it. Anna, Jeanne, thank you very much.
Thank you.